Welcome to The Explainer. Today, we're diving straight into a health statistic out of South Asia that recently caught the global medical community completely off guard. When we look at global childhood illnesses, we usually think we've got a pretty solid grip on where the burdens lie. But every now and then, a single data point drops and just forces everyone to rethink the entire landscape. We're talking about childhood leukemia today. It's a complex, multifaceted disease, and it demands a deeply nuanced understanding. Our goal here isn't just to throw shocking numbers at you. We want to shine a light on what the data is actually telling us about global health progress, and, just as importantly, what it isn't.
Okay, let's dive right into this. 70%. When you first hear that number, it feels almost impossibly high, right? According to a massive, comprehensive recent study, India currently accounts for a staggering 70% of all childhood leukemia cases across the entire South Asian region. Just pause and think about that geography for a second. South Asia is a massive, diverse subcontinent. It's made up of 8 different countries, housing nearly a quarter of the global population. So how could one single country hold such a monumental share of the region's burden? It sounds deeply alarming. Honestly, it sounds like there might be a sudden, localized crisis. But as we know, a single, isolated number rarely tells the whole story.
India commands a massive 70% slice of this data, which leaves just 30% for the entirety of the rest of South Asia combined. We're talking about places like Pakistan, Bangladesh, Nepal, and Sri Lanka all sharing that smaller slice. Isolating India's share like this really drives home the sheer scale of the regional leukemia burden concentrated within its borders. It's the kind of imbalance that immediately prompts 100 questions. You might be wondering, is there a new environmental trigger? A sudden localized outbreak? Well, before we jump to conclusions and assume this overwhelming share is driven by a localized hazard, we really have to look underneath the surface of the data. We have to understand the hidden structural mechanics that actually build a statistic exactly like this.
So, let's get behind the numbers and contextualize this data.
Now, what's really interesting here is the juxtaposition. Those raw, towering case numbers, they only really make sense when they are placed right next to the vital context of population demographics. See, India holds one of the largest populations of young people on the entire planet. We are talking about hundreds of millions of children and adolescents. To put that into perspective, India actually has more young people than the entire total population of the United States. When your denominator, the total number of kids living in a country, is that exceptionally immense, your numerator, the raw number of cases, is naturally going to completely eclipse neighboring nations that have significantly smaller youth demographics. It's just a mathematical certainty. Context is absolutely everything here. But beyond just the sheer scale of the demographics, there's a much more fascinating and frankly optimistic structural driver at play. This 70% statistic isn't purely an indicator that more children are mysteriously getting sick. Actually, it heavily reflects a profound victory. More children are finally being properly diagnosed. Over the past decade, we've seen incredible emerging healthcare capabilities, massive telehealth expansions in rural areas, and much sharper screening protocols. Cases that previously went completely undetected or were tragically misdiagnosed as just common fevers or infections are now being accurately identified and officially recorded. It's a classic paradox in public health, right? Sometimes a rapidly rising statistic actually means the system is working better than ever before.
Moving on to the healthcare burden, let's take a look at the on-the-ground reality.
So, the crucial point here is the severe gap between this newly identified towering patient volume and the highly specialized resources required to actually treat them. Accurately diagnosing the disease is an incredible life-saving achievement, no doubt about it. But having the specialized pediatric oncologists and dedicated treatment centers ready to fight it, that is a much steeper, far more daunting challenge. Think about the timeline for a second. Identifying a new case through a modern blood test can literally happen in a matter of days. But training a highly specialized pediatric oncologist, that requires well over a decade of intensive medical school, residencies, and fellowships. That mismatch creates a massive, immediate bottleneck where diagnostic speed vastly outpaces the treatment infrastructure. It's not just about more kids getting sick, it's about more kids actually getting diagnosed. Think about the human element behind this reality. Imagine the immense daily challenges faced by frontline healthcare workers in these rapidly developing medical hubs. They are managing an unprecedented rising tide of diagnoses. They're doing the grueling, incredible work to identify this illness earlier and earlier, giving these kids a real fighting chance. But they're operating in an environment where hospital bed space, specialized chemotherapy wards, and support staff just haven't necessarily caught up with their own diagnostic success. They're fighting a relentless uphill battle to save lives every single day, often stretching limited resources to their absolute breaking point.
Now let's talk about bridging that treatment gap and charting the path forward.
And this brilliantly illustrates the strategic roadmap ahead of us. This study doesn't just present a grim public health problem. It actually lays out a clear, actionable path for policymakers. It starts with expanding early detection networks even further into remote areas, because catching childhood leukemia in its earliest stages is an absolute game changer for long-term survival. But, as we know, detection requires immediate treatment. That's why drastically increasing specialized medical staff training to build a veritable army of pediatric oncologists is absolutely paramount. And finally, those trained professionals need the physical infrastructure to administer complex, modern care. We aren't just talking about extra hospital beds here. We're talking about advanced pathology labs, sterile isolation rooms for immunocompromised patients, and comprehensive regional blood banks.
Data is only as valuable as the action it inspires. It's incredibly easy to look at a massive, overwhelming number, like 70%, and feel entirely defeated by the sheer scale of the crisis it implies. But as we've explored today, understanding the nuance behind the statistics, realizing that higher numbers also represent a hard-won victory in better global detection, is absolutely vital. This mindset shift changes everything. It transforms an intimidating, paralyzing statistic from a sign of despair into a clear, focused call to action, driving targeted infrastructure funding and global health initiatives exactly where they are needed most.
As diagnostic capabilities continue to rapidly improve globally, finally uncovering the true scale of illnesses that were once hidden in the shadows, a really critical question remains. How will rapidly developing nations scale their specialized pediatric care to meet the heavy demands of tomorrow? The data tells us exactly where we are right now, but it's entirely up to us to decide where we go next. Thank you so much for joining me for this explainer. Keep asking questions, always look past the raw numbers, and I'll catch you next time.